Dr. Oz, the newly sweared-in head of Medicare and Medicaid services, is ready to crush fraud, waste, and abuse plaguing the system.
Almost 250,000 people, American citizens, were fraudulently enrolled without their knowledge in exchange programs by brokers who were unscrupulous, stealing from the U.S. government by pretending these people were on programs they never told them about. Tens of millions of dollars, Mr. President, are being spent on illegal immigrants receiving Medicaid in California, and they're pushing the bill to us. Should we stop that? I think so. That will not continue. We're spending about $1 billion on Medicaid programs for dual state eligible patients, which means you live in one state, but the system thinks you're another state, and maybe a third state, and we're paying all three states for services you're not getting because you don't live in three states all at once. And finally, and this one really bothers me, there are states who are using Medicaid dollars for people who are vulnerable are being used for non-medical purposes. For example, public labor unions are getting child care through some of this money. That doesn't make sense to me. Housekeeping, I wish I could get that for my home. There's a big problem with student loan repayments taking place with Medicaid dollars. That's not where it should be used. And we are paying for DEI programs. I could go on, but these are all programs, Mr. President, that we have created a war room at CMS to go after, to catch the fraud in real time before the money leaves the federal coffers, so we have the money to reinvest in health care to make it even stronger than it's been before. Together, we're going to make the care better. We're going to make the outcomes improve, and we're going to make sure that America can actually be the healthiest country that could ever possibly be.